Between shoveling and just navigating slippery sidewalks and roads, let's face it, winter can lead to all kinds of aches and pains.
But you don't have to go through the whole season feeling lousy. Dr. Christopher Miller is here today with some help, and he's brought along one of his patients, Bonnie Weatherwax. Good morning.
Good morning.
Okay, this is the time when people are shoveling heavy snow. They're walking across the ice. You've got to see a lot of patients that come in and have aches and pains, and they don't want to go through life like this.
That's right, Jordan. Just like you said, those weekend warriors doing those sports on the weekends or those chores trying to get caught up for the week and sort of tweak something and don't feel right. But we also help people with chronic headaches, neck and back pain, and then the more serious conditions where people are really just struggling to live their everyday life because it's so severe. And it may be more than just neck or back pain. It could be shooting down the leg or the arm, leading to weakness in the extremities. Many of them have been told they have spinal stenosis, herniated or bulging or ruptured discs, and then even a lot of people that have had neck or back surgery or injections where they're facing those treatments and don't really want to go that route. Those are the type of patients we can help, and we don't do any invasive treatments. So there's no cutting or drugs or surgery. We're really working on fixing the problem, not just masking the pain.
You have a lot of different patients, as you mentioned, facing a lot of different ailments, and Bonnie is one of them. We want to thank you for coming in today. You started seeing Dr. Miller in November. Can you just explain what your life was like, what kind of pain you were experiencing at the time?
I was living with quite a severe pain that you just learn to mask and you learn to live with it because you think that's all there is. It was impeding a lot of my daily life in that I couldn't do a lot of walking because I was just totally worn out. I couldn't do housework. I couldn't bend over. There wasn't a whole lot I could do, but I just learned to live in a state of pain.
Right. And you started on the program.
Yes.
And then what was your experience after you started?
The first treatment on the DRX, which was painless, I went to bed that night and I slept better than I've ever slept in a long time. I got up the next morning and I said to my husband, I don't have any pain. I can't believe it. I don't know how to act. One of the questionnaires on Dr. Miller's paper was, how long have you been in pain? I couldn't even give an answer because I've just lived with pain so long that I can't remember when I didn't have pain.
That's incredible.
And Dr. Miller, you see this often. Patients will come in unbelievably and remarkably. They feel better for the first time in so many years, and a lot of patients feel like this is just a way of life. They have to live with the pain.
Well, what we do is unique treatments, and we're the only facility in West Michigan with this, so there aren't a lot of people that know about this, and that's why we're trying to spread the word. But I'm very fortunate that Bonnie and I connected because she had problems in her lower back as well as her neck. We've worked on both of those areas, and it's just exciting that she's getting back to living life. And boy, I even just had a baby, and she was able to knit some booties for her.
Oh, that is wonderful. That's great. Well, I know that you do a lot of things, not only the DRX 9000 and the different programs and the supplements and getting people very healthy. You're always doing added things. And you mentioned something, rock tape, that I don't know if everybody who's watching knows what that is or how it can help a person. But Bonnie is someone that was helped by rock tape, and I know that other patients as well.
Well, many people don't know what it is, but they've actually most likely seen it before. Many
of professional athletes.
Yeah, sporting events, you'll see this tape that's around their joints on their shoulder, arm, or down their hip or knee or leg, and this is rock tape. And so many of our patients get this done. We tend to do it maybe on a Friday before the weekend so that they can enjoy their weekends a little bit better since they're not coming into the office on those days. But it's a way to support the joint, increase healing and circulation, and just give it a little extra support so that they can get through their daily activities and not struggle in pain and get through till they come back to the office.
Yeah, and Dr. Miller at Total Health Chiropractic, you're helping so many people feel better, and like Bonnie said, it was one time and she felt better, which is so great. So if people are watching at home and they've been living with these aches and pains, you treat so many different ailments and so many different problems. Right now is the perfect time to not mask the problem, but get to the root of the problem while it's so cold outside, because that can cause extra aches and pains as well.
Absolutely, and like we had said, a lot of people haven't heard of what we do, and so we're offering a great opportunity for them to come out to our office. We're going to have an open house tomorrow evening, and people can just come on out and see what we have to offer, take a look at these different treatment options that we have, and frankly try a lot of these treatments. We're going to have free massage. They can check out our therapists. They're going to get to do some of our 3D rehab sessions with Spine Force, get some rock taping done if they have joint problems. And I, as well as my associate doctors, will be around to answer questions so that they can learn. It's not the end of the road, and there is hope for them still available, and we're the place to help them out.
Yeah, and Bonnie, just have to ask you, we're starting a new year. It's 2015. Are you really looking forward to how this year could be a little bit different than previous years because your health has changed?
Absolutely. I love hiking, and I can now get back to walking without pain.
Amazing.
That's
Great.
amazing.
It's
That's
really
great.
exciting.
Yeah, and we know that it starts for a lot of people by attending an open house. So if the phones are busy, which I know a lot of people want to come out and kind of check out, take advantage of some of the great specials and opportunities you have.
The massage.
Yes, just call back and we'll make sure to, I know the folks in your office to help anybody, you know, get them in to be able to get on that path to recovery.
I just want to make a point. You don't have to call our office to attend the open house. Just show up tomorrow night.
Okay.
We'll be ready to go. But if they can't make it to that event, we do have the $20.15 special to call our office and get scheduled for a consultation exam, and we'll show them exactly what's causing their pain and what we can do to help them out. So
That's
a couple
wonderful.
options for them there.
And I have to add, I talked to 2 patients that I was sitting beside in the chair. One was 90 years old and one was 93.
Wow.
And they did not look like it. They did not move like it.
That's incredible.
It's amazing.
Yeah, well, that's some credit to definitely what you're doing and making people feel better.
It's never too late.
Without
Never too late.
surgery, right?
Yeah.
Thank you both for coming in. We appreciate
It's my
it.
pleasure being
you.
back.
Have
Thanks.
fun with your grandchildren now.
Thank you.
Yeah.
All right, don't go away. We'll be right back.